technique is used to reduce sensory defensiveness and facilitate organization in the body. It was developed by Patricia Wellberger, OTR/L. It must be done with a specific brush. The brushing program should be done every 2 hours and can be done over clothing. Brush with deep pressure so that all the brush bristles bend. Do not scrub. Instead, use long, firm strokes. Try not to lift the brush off of the body during brushing. The brush needs to be held horizontally to the arm or leg, and sufficient pressure needs to be exerted to flatten the bristles. The complete routine should only take about 3 minutes. Use the correct brush provided by your therapist. Store it in a plastic bag and replace it when it comes stiff or scratchy. Try to commit to this technique for a period of 2 to 3 weeks, every 90 minutes to 2 hours. Monitor your child's responses and observe for changes in behavior and reactions to other sensations. Some children immediately enjoy this input and others resist the first few sessions. You may distract the child by singing or offering a mouth or fidget toy. If the child continues to resist and negative changes are observed, contact your therapist. Every child has a unique response to this input. This technique can be incorporated into a sensory diet schedule. Regimen must be repeated every 1 to 1.5 to 2 hours to lay down neutral pathways. Neurotransmitter release only lasts that period of time. Positive changes usually can be seen in a few days. If no change after 3 to 5 weeks, then situation should be reevaluated. Precautions. Avoid brushing over skin lesions. Report any unexpected responses promptly. Reddening of compression component. Brushing is followed immediately with quick compressions given as 10 quick presses to key joints of upper and lower extremities, shoulders, elbows, wrists, hips, knees, and ankles. Compression fools the brain into thinking bone may become displaced, and all proprioceptors in immediate area fire to stabilize and protect the joint. Brushing does not achieve same results if self-administered, but compressions can be self-administered, such as jumping in place or push-ups up against a wall. Until have expertise, do not incorporate head or neck or spinal compressions. Now we will demonstrate compressions on the hip and on the knees, and compression on the ankles. Next leg, on the hips, compression on the knee, and compression on the ankle.